Pelvic inflammatory disease is a significant health issue and a major cause of infertility worldwide. Although its incidence varies greatly globally due to factors like access to healthcare or diagnosis, it remains a leading cause of infertility in females. So, based on these statistics and also on studies, in fact, studies have shown that women who have experienced PID, from between 5% to 60% of such women are more likely to experience infertility in the future. So, based on these statistics, I will be telling you a lot more of what you need to know about pelvic inflammatory disease, also known as PIDs. I will be telling you what causes these PIDs, what are the signs and symptoms, what are the treatments, and what are the complications. In fact, this will lead us to explaining exactly how these PIDs can cause infertility in females. If this is the kind of topic you would like to know more about, please keep watching. Also, do not forget to give me a like and subscribe to my channel, because here we share topics about fertility, women's health, and everything health. So let's get into it. So let's begin by telling you what exactly PIDs are, also known as pelvic inflammatory disease. So pelvic inflammatory diseases are simply an infection of the upper pelvic or the upper reproductive organs of the females. So when we talk about these organs, we are referring to the uterus, the fallopian tubes, and the ovaries. So an infection of these pelvic organs is what we call the pelvic inflammatory diseases. So now, what actually causes this pelvic inflammatory disease? One of the major causes of this pelvic inflammatory disease are bacterial infections. So when these bacterial infections spread from the vaginal opening to the cervix and then ascend into the womb, which is also known as the uterus, it can spread to other pelvic organs like the fallopian tubes and the ovaries. This is one of the causes of pelvic inflammatory disease. Now, however, it's been found that a vast or a larger majority of pelvic inflammatory diseases are caused by sexually transmitted infections, especially chlamydia and gonorrhea. So these two major infections has been seen as the major cause of PIDs in females. So we'll be talking more about this as we proceed. So let's talk about the symptoms of PIDs. The very first symptom of PIDs is pain. So when we talk about pain, we are referring to lower abdominal pain, also known as pelvic pain. So sometimes the patient has very severe pain. Some patients really get ill just from this severe pain in the lower part of their abdomen. So the next kind of pain a patient experiences with PIDs is pain during intercourse, and this kind of pain is felt deep inside the pelvis. Then the third type of pain is pain during urination. So you see, this kind of patient is faced with different kinds of pain. And the fourth one is pain during period, very severe painful periods. In most cases, you find out that patients that present with very severe painful periods usually have a form of sexually transmitted disease or pelvic inflammatory disease untreated. Now, let's talk about other symptoms. Other symptoms also involve bleeding between periods or bleeding after sex. So that is also another common sign in patients with pelvic inflammatory diseases. Next sign is unusual vaginal discharge. So this one is something that can be seen. So you experience some kind of abnormal vaginal discharge, which could be yellowish or greenish in color and has very bad smell. So that is also a sign that you could be having pelvic inflammatory disease. And the final sign I will be talking about are heavy periods. So when you experience one or more of these signs, it is a very good time for you to go see your doctor, as it could be an indication of pelvic inflammatory disease. So having come to know about the signs of pelvic inflammatory disease and come to know about the causes of pelvic inflammatory disease, now let's talk about the treatment options available. Now, I will be giving you a very basic treatment option, but if you really think you have this infection, it is really time to see your healthcare provider to give you your own personalized form of treatment. But generally, when we talk about this, it is not something that has no cure. So it is generally treated with antibiotics. It can be treated with either oral or intravenous antibiotics. So based on your results and the sensitivity test that has been conducted on you, your doctor will give you the most appropriate antibiotic in the right dosage. So that is the treatment of pelvic inflammatory disease. Now, what happens when a person does not get the accurate treatment for this infection, or probably the person did not get treated at all? What are the complications and how can this lead to infertility, which is the main reason we are watching this video, right? Now, the major complication of PIDs is that it causes infertility. How does it cause infertility? Now, this PIDs causes a lot of scarring in the fallopian tubes. So, this scarring makes it very difficult for the sperm cells to swim through the fallopian tube in order to fertilize the egg. And when the sperm cells cannot meet the egg to, fertilize the egg, then fertilization cannot take place and implantation cannot take place. So the woman cannot get pregnant. So this is why pelvic inflammatory disease must be properly treated to avoid this kind of complication. Now, the next one is that it leads to ectopic pregnancy, is another complication. Now, what happens is that ectopic pregnancy simply means when the fertilized egg does not implant in the uterus, but rather implants in the fallopian tube. Now, how does this happen? Remember that initially pelvic inflammatory disease has been said to cause the scarring of the fallopian tubes. Now, when the sperm cells manages somehow to swim through these scarred fallopian tubes and then manages to fertilize the egg, it is quite difficult for it to travel back and get down into the uterus to implant where it should be. So in most of the cases, it ends up implanting somewhere in the fallopian tube. And remember that the uterus is meant to be able to expand and expand and expand to accommodate the developing fetus. But in this situation, when this fertilized egg, or this fertilized egg, yeah, which is now a zygote, has implanted in the fallopian tube and begins to grow, it gets to a point where it ruptures the fallopian tube, and this is a very serious obstetric emergency that must be handled immediately, because it is indeed a life-threatening emergency. So it is a very serious complication, ectopic pregnancy. And when this happens, at the end of the day, the woman is not able to get pregnant or have a baby. So this is exactly how PIDs can cause infertility in females, and thus the reason why it must be treated. So I hope this video has really been beneficial to you. If it has, please kindly give me a like and subscribe to my channel, because here I share helpful tips on fertility, women's health, and everything health. Thank you for watching, and do not forget to leave your comments in the comment section. I'll see you in my next video. Bye for now.